Niagara Health has been hosting a series of community engagement sessions throughout the region, with a few still to come. We're joined by Lynn Guerriero and Heather Paterson. Lynn, the sessions so far, have they been well attended by the public?
Yeah, I would say very well attended. We've had really great attendance so far in Niagara Falls, in Fort Erie, in Port Colborne, and Welland. St. Catharines, less well attended, but St. Catharines is less impacted by any of the new changes, since they have an almost new hospital with the last 10 years. So, so far we've had good attendance, but really great engagement, great questions, lots of people raising concerns, and that's why we were doing these sessions, to make sure we were hearing from the community and they could hear from us about our future plans for Niagara hospital system.
What are some of those concerns that they've been expressing?
Well, as we modernize the hospital system, moving to a 3-site model, people are always concerned about those types of changes, and access to healthcare services, access to high-quality healthcare services, is obviously a concern for everyone in Ontario. And when that is changing for us, we recognize then that can be stressful for people. So some of the concerns raised, of course, is what impact will this have on access to care? What impact will this have specifically on access to emergency care? Given that we will be moving from 5 sites to 3, it means that we will eventually, in 5 years' time, be closing the sites in Port Colborne, Fort Erie, and Niagara Falls.
Right.
And the new, much bigger site will be opening in Niagara Falls. So there is concern in the community about those changes, and what the community engagement sessions are trying to accomplish is to assure people that actually these changes will be increasing access to care, increasing access to emergency services, and most of all, increasing access to highly specialized teams in beautiful, modern infrastructure
right.
and technology, so that the quality of care will also go up. So we are trying to make sure that the community understands that, and also where to go to access non-hospital care, to make sure that people understand the differences between, for example, services you could receive at an urgent care center, which is not an emergency department,
right.
versus a fully functioning emergency department.
Heather, your role as VP of Clinical Operations, what is your role in these sessions?
Well, I think it's important for the community to understand that I live here, I was born and raised here, and so it's my job and responsibility to make sure that we have good access to care, that the community understands where they should best seek care. And of course, coming to the hospital will always look after you, but I feel it's our responsibility as a hospital system to educate the community on where to seek services, whether it's urgent care, whether it's your primary care. Post-pandemic, we were able to increase services, accessing care virtually by pharmacists. So I think that it's really important as we move into this new development, into the 3-site model, that we have a responsibility to educate the public.
Even though we say a 3-site model, the Welland Hospital will still have a big role here, right? Yeah. What will that role be?
So the Welland Hospital is the 3rd of our 3 sites. It's a cornerstone of this strategy. The strategy does not work without Welland being not just open, but actually redeveloped into a modern facility. That facility is also quite outdated, and so moving forward, we need to redevelop the site to make sure that we have modern infrastructure there. So the Welland site will become the site where we do a lot of our what we call ambulatory procedures. So those are procedures or tests or evaluations you can have without staying overnight at the hospital.
Right.
So lots of diagnostic imaging, as well as surgical procedures that can be performed same day. And what we're hoping and what we're asking of the community is, what are all of the clinics that people would like to see there? Expansion of mental health clinics, for example, geriatric assessment clinics. We're going to have a center of excellence in eye care there. So not just cataracts surgery, but what are all of the ambulatory services or walk-in services people would like to see? So that site will continue to be a main hub for us. Because the site is so big, it also gives us an opportunity to add other services to that site. So if we think of the services that don't necessarily need to be provided by a hospital, but might be nice to have adjacent to a hospital,
right.
we would like to hear from the community. So things like a new primary care team, for example, things like seniors wellness classes, things like perhaps community diagnostics might also be housed there. So we're asking for the community what types of things they would like to see on that site, but absolutely that site is to remain open and to be redeveloped.
And Heather, we're looking at, even with this 3-site system, we should see improvement in emergency room waiting times.
Yeah, for sure. So emergency room wait times are a huge concern for us, and I know as well, we heard that during our community engagement sessions. And so a couple of things. One is our new South Niagara Emergency Department actually is 3 times larger than what we presently have at our Niagara Falls site, and it'll accommodate over 90,000 visits. So I think there's an opportunity there for the bigger department. As well, at the South Niagara, there will be all private rooms. So with all private rooms, it allows us to flow our patients through in a more expedited way through our emergency department. So that's one positive. The other thing is that we, again, we access emergency care, but like what as a community can we do in order to seek care appropriately, primary care, urgent care, things like that.
Knowing where to go.
And where to
right
go.
Situation.
Absolutely where to go for the right situation. And then as well, I think that we need to, as we work through our health human resource crisis really across the country, it's important for us to realize that a new build, new programs, community involvement, hospital involvement will actually will allow us to recruit the best and the brightest, right? Because we're all competing for the same resources, and so we're very excited to think about what the art of the possible is.
Heather, Lynn, thanks for joining us, and we know that there are a few more of these community engagement sessions. Please visit the Niagara Health website to find out those dates and times. Thanks again.
Thank you so much.
Thank you.